If you've ever felt a stabbing pain in your heel first thing in the morning or after a long period of rest, you're not alone. That sharp, aching sensation might be due to plantar fasciitis, one of the most common causes of heel pain. It affects millions of people, from runners and athletes to people who spend long hours on their feet. Today, we'll take a deep dive into plantar fasciitis, what it is, why it happens, how it's diagnosed, and most importantly, what you can do to treat it, including home remedies that can help relieve the pain. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Plantar fasciitis occurs when the plantar fascia, a thick band of tissue that runs along the bottom of your foot from the heel to the toes, becomes inflamed or irritated. This tissue acts as a shock absorber supporting the arch of your foot. However, excessive stress or strain can lead to small tears in the fascia, triggering pain and stiffness. The most common symptom of plantar fasciitis is a sharp stabbing pain in the heel, especially with the first steps in the morning or after long periods of inactivity. Many people describe it as a deep ache that eases as they move around, only to return after prolonged standing or walking. The pain is often worse after exercise, not during it, which can sometimes make it tricky to identify. Although plantar fasciitis can develop in anyone, certain factors increase the risk. People who spend long hours on their feet, such as teachers, retail workers, and healthcare professionals, are more prone to developing it. Runners and athletes who place repetitive stress on their feet, particularly those who suddenly increase their training intensity, are also at higher risk. Foot structure plays a role as well. People with flat feet or high arches may experience abnormal stress on the plantar fascia, making them more susceptible. Additionally, obesity increases the strain on the foot structures, leading to a higher likelihood of developing inflammation in the fascia. Wearing unsupportive shoes, such as flip-flops, high heels, or worn-out sneakers, can contribute to the problem by failing to provide the necessary arch support. If you're experiencing persistent heel pain, it's important to get an accurate diagnosis. A healthcare provider will typically diagnose plantar fasciitis based on your symptoms and a physical examination. They'll check for tenderness in the bottom of your foot, particularly near the heel, and assess whether the pain worsens when you flex your foot upward or apply pressure. Imaging tests such as x-rays or ultrasounds are not always necessary, but they may be ordered in some cases to rule out other potential causes of heel pain, such as stress fractures, arthritis, or heel spurs. A heel spur is a bony growth that can form on the heel bone, often associated with plantar fasciitis, although it's not always the primary cause of pain. Once diagnosed, the good news is that most cases of plantar fasciitis improve with conservative treatment, though it can take several weeks or even months for symptoms to fully resolve. The key is to reduce stress on the plantar fascia and promote healing. One of the most effective ways to manage plantar fasciitis is through stretching exercises. Tight calf muscles can put extra strain on the plantar fascia, so daily stretching can make a big difference. Simple exercises such as standing calf stretches, rolling a frozen water bottle under the foot, or using a towel to stretch the arch can help alleviate tightness and improve flexibility. Proper footwear is also crucial. Supportive shoes with good arch support and cushioning can prevent further strain on the plantar fascia. If your current shoes lack support, consider using orthotic insoles or custom shoe inserts to provide additional cushioning and distribute pressure more evenly. For those experiencing significant pain, rest and ice therapy can help reduce inflammation. Applying an ice pack to the affected area for 15 to 20 minutes several times a day can soothe irritation and decrease swelling. Some people find relief using a frozen water bottle to roll under their foot, as this provides both a cooling effect and a gentle massage. Pain relievers such as non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen or naproxen can be used temporarily to manage discomfort and reduce inflammation. However, these medications should be used as needed rather than as long-term solutions. Night splints can also be beneficial for those who wake up with severe morning pain. These splints keep the foot in a stretched position overnight, preventing the fascia from tightening while you sleep. Although they can take some getting used to, many people find significant improvement with regular use. For cases that don't respond to conservative treatments, physical therapy may be recommended. A physical therapist can guide you through specific exercises and techniques to strengthen the foot muscles, improve flexibility, and reduce strain on the plantar fascia. In more persistent cases, additional treatments may be considered. Corticosteroid injections can provide temporary relief by reducing inflammation, though they are typically reserved for severe cases because frequent injections can weaken the plantar fascia over time. Shockwave therapy, a non-invasive procedure that stimulates healing in the tissue, is another option that has shown promising results for some individuals. Surgery is rarely needed but may be considered for chronic debilitating cases that don't respond to other treatments. The most common surgical procedure for plantar fasciitis is plantar fascia release, where part of the fascia is cut to relieve tension. However, this is generally seen as a last resort. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics or questions you want covered in future videos. Anyway, in addition to medical treatments, several home remedies can help speed up recovery and prevent recurrence. Weight management is an important factor, as excess weight places additional stress on the feet. Maintaining a healthy weight can reduce strain on the plantar fascia and decrease the risk of future flare-ups. Simple lifestyle adjustments, such as avoiding walking barefoot on hard surfaces, can also make a big difference. Walking with support, especially on tile or hardwood floors, can increase strain on the fascia. Instead, opt for cushioned house slippers or supportive sandals when walking indoors. For those who stand for long hours at work, using a standing mat or cushioned insoles can help reduce pressure on the feet. If your job requires prolonged standing, taking short breaks to stretch or shift weight between feet can help alleviate strain. Regular massaging the foot can also promote healing and improve blood circulation. Using your fingers, a tennis ball, or a massage roller, gently apply pressure to the bottom of the foot to loosen tight tissue and reduce discomfort. If you have plantar fasciitis and are looking for ways to stay active, consider low-impact exercises such as swimming or cycling. High-impact activities like running and jumping can worsen symptoms, so modifying workouts can help prevent further irritation while you keep moving. So plantar fasciitis can be a frustrating condition, but the good news is that most people recover with the right combination of rest, stretching, footwear changes, and home remedies. While it can take time, being consistent with these treatments can help relieve pain and prevent the condition from coming back. Thank you for watching. As always, take care of yourself and make the most of your day.